Hey guys, this is Dr. Hub. Now let's compare marasmus with the kwashiorkar. So we begin with marasmus. Marasmus is seen in infants less than 1 year of age. So it is less than 1 year of age. And how is the calorie? It represents a total calorie deficit. So it is a total calorie deficit. So how about edema? There is no edema. This is very important. In terms of marasmus, there is no edema. So commenting on the appetite, they have a voracious appetite. There is voracious appetite as well as there is no apathy. There is no apathy. Next is a question on the muscle wasting. Is there muscle wasting? So the answer is muscle wasting. It is very severe. It is a severe form of muscle wasting. So how is the ribs? There is presence of the prominent ribs. So there is prominent ribs are present. So looking at the fatty liver and subcutaneous fat, there is no fatty liver as well as there is no subcutaneous fat. Now let's look at the special features. So when you're looking at the special features, they include alertness. So the individual is alert. They are able to lose wrinkled skin. So this is all in terms of marasmus, and there is a baggy pant appearance. Now on the other hand, let's look at the kwashiorkar. So now we are going to look at the kwashiorkar. So under kwashiorkar, which age group is this seen? So marasmus was seen within less than 1 year of age, whereas kwashiorkar is seen in older children. So kwashiorkar was seen in older children, and that is approximately, you can tell, 6 months to 3 years of age. 6 months to 3 years of age. So what is the deficit here? So the deficit is nothing but in the protein. So it is protein deficit. And how about edema? Edema is present. So there is edema, and the edema is very prominent. So how about appetite? In kwashiorkar, there is a loss of appetite. There is loss of appetite, and there is also presence of the apathy. There is presence of apathy. Next is, what about muscle wasting? So in terms of muscle wasting, so muscle wasting is considerably, it is mild or absent. It is mild or it can be absent. Whereas in terms of marasmus, the muscle wasting, it was very severe. So how about the prominence of ribs? Here there is no prominence of ribs, but there is a protuberant abdomen. This is very significant. Protuberant abdomen. Next is a question on the fatty liver and the subcutaneous fat. So there is presence of fatty liver. So we can say that there is presence of the fatty liver as well as there is presence of the subcutaneous fat. There is presence of the subcutaneous fat. Now what is the special features in terms of the kwashiorkar? The special features, it includes moon face. So there is a moon face. Next is, there is presence of the flank paint dermatosis. There is flank paint dermatosis, and there is also presence of the flag sign. The flag sign is basically there is a color change in the hair, hypopigmentation. That is nothing but the flag sign.